Has this ever happened to you, maybe your daughter, a niece, or a female friend? You discover you have some sort of a medical problem related to your female biology, so you make a visit to the OBGYN, and what do they say? Well, the pill, the birth control pill, that's the answer. Well, we are here to tell you that it's not the answer. Hi, I'm Teresa Tomeo, co-host of The Catholic View for Women, joined again by my dear friend and sister, Astrid Bennett Gutierrez from, of course, Hispanics for Life, and my sister Janet Morana from Defending Life here on EWTN, also from Priests for Life, and of course the Silent No More Awareness Campaign. I can't tell you how many women, and I went through it, Janet, you went through it when I was a teenager because of very, very heavy periods.
Yeah.
The doctor right away tried to put me on the pill.
Yeah, well,
and then when I went into, my mother said no, but as I got older and they really couldn't find it, they didn't think they had an answer. In high school and college, I was on it for a little while, and it caused a lot of problems.
Oh, wow. That's right.
Yeah.
Same thing happened to me, basically. You know, in high school, extremely heavy periods. I mean, so much so that you feel like you can't even leave the house. And that's what we're talking about, heavy periods. You know, you can't go to school that day. And my mother's Catholic, OBGYN said, well, you know, put her on the pill. I mean, I wasn't sexually active at all, but the idea was they just were handing out the pill like it was
like candy.
No big deal, you know. And I know we've covered this topic on a number of our shows in the past. And of course, we talk about the work of Dr. Hilgers and naprotechnology and how there's so many doctors trained around the country. But then our viewers would email us and say, but none of those doctors are in my community. What should I do? And so what we did was, thanks actually to Astrid, you know Dr. Teresa Stegen, down there in Southern California. And why don't you just tell our viewers a little bit about her?
She's a wonderful pro-life gynecologist who has a pro-life approach to her work, and basically, which means she does not promote ever abortion or contraception, but then she also provides healthy alternatives, ethical alternatives like naprotechnology. She's trained by Dr. Hilgers.
Right.
So Dr. Hilgers, what he's done is, instead of people feeling like they have to go to Nebraska to be seen by him, he's trained physicians. And just out of medical school, Dr. Stegen went to study under Dr. Hilgers to learn naprotechnology, to be able to bring this wonderful hope for Catholic women, for all women really, because this really does address the issues that women are facing. The pill's not the answer. Even though a pill's not a sin, we should say, for medical reasons, you still get all of the negative effects of it.
It's a group 1 carcinogen, as we know, by the World Health Organization. Our good friend Angela Manfranchi, the Breast Cancer Prevention Institute and all that, she has spoken so clearly about how bad the pill is. You know, it's a cancer-causing agent. But when we sat down with Dr. Teresa, I remember I said to her, look, you have to help us. Now, what we're giving here, I want to be clear to our viewers, this is not medical advice for you per se. But what she does is, and you're going to listen to this now in a minute, she tells you the questions to ask your doctor.
See, this is so important.
That's what's so important.
Because how many, as you said, if you don't have a pro-life OBGYN, you really have no alternative but to go to someone who might be prescribing and believing in these things that are against our beliefs. But you can push a little bit and be proactive. You have to. We just can't take things for granted now. We have to make sure we're doing the right thing for ourselves.
So we asked her, with the first question we said to her, okay, heavy periods, and of course the other biggie is acne. As you know, they give, believe it or not, they give the pill to girls because of acne. So let's see what Dr. Teresa said and get your notebooks out, brothers, just take notes, but let's see what she had to say.
So in my practice, I do get a lot of mothers who bring their teenage daughters with various women's health conditions, heavy periods, painful periods, premenstrual syndrome. And I'm able to treat those very successfully with naprotechnology. Naprotechnology stands for Natural Procreative Technology, and it's a means of identifying underlying causes for women's health conditions and then addressing those. So that's the approach that I take in my office, and it's very successful. However, sometimes a naprotechnology trained physician is not always readily available to other women in other parts of the country. That's okay. There are still things that you can do or that you can request of your physician to get good assessment and treatment for the conditions that your daughters may be facing. For example, say your daughter has heavy menstrual periods. Often what physicians will do is simply put her on the birth control pill. There's a number of reasons why that's not a great idea. First of all, there are side effects to the birth control pills, some just annoying, like weight gain, some that are more serious, like blood clots or liver tumors. So what you can do is when you go in to your physician's office and they present you with birth control for her heavy periods, try asking them, well, why is she having these heavy periods? There are things that you can ask for. For example, what causes heavy periods? Fibroids can cause heavy periods. Adenomyosis, a condition where the lining of the uterus invades the muscle of the uterus, causes heavy periods. Bleeding disorders like von Willebrand's disease, which is a disease of not clotting your blood well enough, and it's a genetic tendency, can cause this. Other blood clotting disorders that are more poorly defined can cause it. Hormonal problems can cause it. Having low progesterone tends to predispose you to heavier periods. Or having something else like a mass in the lining of the uterus can potentially cause it. So ask them, what's causing this? And can we look for ways to identify what the causes are? Typically speaking, in my practice, I would evaluate them with an ultrasound to see if there's any fibroids, if the lining of the uterus is abnormally thick, which might indicate any sort of a mass inside the uterine lining. I would check them with blood work for their blood clotting ability. Is there any problem with that? And then I would check them for their progesterone levels to make sure they're making adequate progesterone. It's very common to have low progesterone, especially in the early years of a woman's menstrual life, because things have not quite evened out hormonally, and those low progesterone levels are going to lead to heavier periods. So those are all things that you can look at. Now, if they come back with the answer of, we still don't know what this is, what's causing it, that doesn't mean that the birth control pill is your only option. If they find that it's not hormonal, it's not fibroids, and you can't direct therapy to those things, there is a medication that is not hormonal and does not increase the risk for breast cancer. It's called Lysteta. It's taken only when you need it and only to reduce heavier periods. So why expose your daughter to the risk of breast cancer and the other side effects that the birth control pill brings when you can get the same sort of relief from heavy periods with the medication that's taken only for a few days out of the cycle instead of every day, and that is non-hormonal in nature and will not interfere with her body's natural cycle. Another common reason why the birth control pill is prescribed is for acne. We've already talked about some of the side effects, serious ones, that the birth control pill brings, and so those side effects remain in effect when it's being prescribed for acne. And so the balance of risk and benefit there is actually pretty bad. To be weighing in for birth control pill just for acne. And the truth is that there are effective treatments out there for acne that don't involve the birth control pill. Such things as topical antibiotics, Retin-A. Sometimes seeing a dermatologist is going to be your best bet in terms of getting effective treatment because they're specialists in this area. More natural causes or more natural treatments are available too. Things like an enzyme called serrapeptase, which helps break down abnormal fibrous tissue, which is part of what's the problem in cystic acne. That's the acne that's really big and deforming and causes a lot of scarring. Serrapeptase is one area that's being investigated pretty heavily as a very effective treatment. So it's really not necessary to be on the birth control pill in order to address acne, and in fact it's quite harmful for the reasons that we've already discussed.
Great interview.
Great. And so, I hope, especially the moms watching, take those points to your doctor, and don't get the pill and make them kind of force. And if your doctor refuses to, then go to another doctor, get another opinion, because she really gave us some good advice. And just to follow up on the birth control pill and acne, I know, Teresa, we were at Legatus conference. We were giving a presentation on the pill, how bad it is.
Legatus is an international Catholic organization of executives, and we were speaking. Actually, you were with us.
We
were at the Catholic View.
All three of us were
there, right?
We were all there. But I was standing online. We were having a lunch buffet, and the woman behind me gave me this story, and she said, Janet, I just have to share this with you that I just came last week from my best friend, her daughter's funeral. And she said this young lady was away at college and began to break out severely in acne. This was her freshman year of college. And she went to the campus doctor, and they wanted to give her Yaz or Yasmin, which is one of the birth control pills. And she called her mom. And of course, this kid was, living a life of chastity. She was didn't even have a boyfriend. And her mom had severe acne, So when the daughter said, well, they want to give me Yasmin to take for my acne, the mother thought of her own experience and said, well, it'll clear up her acne, and she's not sexually active, she's being chased, all right, it's okay. So she started taking the Yasmin, and 3 months later, she collapsed in her dorm. They rushed her to the hospital. She fell into a coma, and she stayed that way for 5 years. And then she passed away it was like the burial was the week before we gave that talk. And here it was, I know the statistics, and there are people suing Bayer Pharmaceutical, which is the company that produces Yasmin, because of women who have died. There's thousands of lawsuits because of physical damage and because of the deaths. But here, God put in front of us this tragedy that we could tell others that it's true. Women are dying from taking the pill. Women are being hurt from taking the pill.
And it's no secret. I mean, you open up these women's magazines, and you have a girl smiling and the package of birth control pills. You flip the page. Now it's two full pages of all side effects.
Right.
Cancer, tumors. I mean, strokes, and we're taking this. I mean, it doesn't make sense at all.
No.
And why isn't there a cancer-causing or other problematic hormone contraception for men? I think that's very, very sexist, don't you?
That's true.
And this is supposed to be freeing, and yet we're the ones who are still injecting all this
Poisoning
garbage
ourselves
into our bodies.
That's right.
It's interesting because I think there's a couple of things going on here, and we're going to continue our discussion after the break because we have another clip with a good doctor. But I think there's a couple of things going on here. This has been an indoctrination of the medical community, which has totally been, again, indoctrinated into saying abortion, contraception, those are just givens. And I also think that, remember the doctor said there could be all these underlying reasons. Well, it takes a lot more work and a lot more effort on the part of a doctor because this is only masking the problems. This doesn't solve any of those problems. If they go off the pill, and eventually they probably will because of complications.
The problems are going to come right back.
Problems are going to come right back. So that's why we're having this discussion, to show you why, for so many reasons. Of course, we know morally and spiritually what the church says about this, but overall, the pill is definitely not the answer. More coming up. Stay tuned to The Catholic View for Women. We'll be right back. Welcome back to The Catholic View for Women, news and views from a truly Catholic perspective. Continue our discussion in this episode on why the pill is definitely not the answer. And Astrid, you wanted to pick up on a couple of points that the doctor made. Doctor is basically coaching families on how to ask for alternatives to the pill. You don't want something that's a class 1 carcinogen in your system. And of course, we know the moral implications. Sometimes young girls on the birth control pill, well, it's a temptation to also understand that maybe they can have sex without consequences. So she's coaching families on how to do this. Now, I want to just warn families that are out there. I get calls from women calling me and saying, look, I'm following your advice, but my doctor, not only did he not know anything about natural alternatives, but he scolded me and sent me home. So I would say to women watching and listening to Dr. Stegan, stick to your guns, insist on better alternatives, and if you don't get the answer you are looking for, go to another doctor, or go on the Pope Paul VI Institute website, find a NAPRO-trained physician. Drive, sometimes it's an hour or two, but it's worth it. It's your daughter's health. A friend of mine did that with her daughter. She lives in Miami, and she drove 2 hours because she was having the same problems with heavy periods. And the OBGYN said the same thing. And right away, she went to see this doctor and started to feel better because she gave her some really good advice. Dr. Stegan is at the Mystical Rose Clinic in Fallbrook, California, which is a 2-hour drive from LA. And sometimes we do have to send women out there, and they go gladly because they're tired of having to put up with the effects of these.
Well, it's really bad medicine. That's what it is. They're practice, and it's lazy medicine because if you heard what she said, well, you have to look further. They just want to write a script. Next patient. Next, what did she say? Oh no, we have to do blood work, wait to get the blood work back. I have to do a sonogram. Like she was going through all these little checkpoints. Why? To make sure that your whole reproductive system is functioning properly.
Yes.
When you think back now, I have friends that developed later on fibroids and all kinds of problems. Well, they probably developed as small little things when they were younger, but they were given the pill. It wasn't diagnosed, and
And it kept getting worse.
Get worse.
Right.
I mean, you hear women sometimes say, "Oh, I had a fibroid the size of a softball or a baseball," and all this stuff. Well, what do you think is going on here? It's undiagnosed, shoving the pill at them, and then later on they have major problems, you know. So you really, like you're saying, Asha, it's good advice. Stick to your guns, you know.
And I think if you push back, a good doctor may at first be a little bit, well, what's this? You know, nobody
Right.
questions me. But if they really care about their patients, you can help them. This is an opportunity in addition to helping yourself, but this could be a means of evangelization, I think.
Yeah, absolutely. Well, we have a little bit more advice from her. We asked her a few more questions, and again, take out your notebooks because I'm the
good
teacher.
stuff.
Take notes, and let's hear what else good advice Dr. Teresa is giving us.
Another common thing that I see moms bringing in their teenage daughters to my office for is irregular periods. This could be anything from having them too frequently, twice a month, to having a period maybe only once or twice a year. And the important thing to understand about this is that that's a symptom of something going on hormonally. This is not something that is supposed to be covered up. You're supposed to be finding the reason why this is happening. But a lot of doctors simply just give the pill because it gives you a nice regular period and now you think nothing's wrong. But the problem is they could be covering up a much more serious health condition. There are different reasons why a woman's cycle might be irregular. It could be due to a thyroid problem. It could be due to high prolactin, which is the milk-producing hormone. It could be due to something called polycystic ovarian syndrome, or PCOS, which is very common. I see a lot of that in my office. It could be due to perhaps she's just early in her cycle and her hormones haven't evened out. So why mess with her hormones trying to even themselves out by giving her a hormonal medication like oral contraceptives? But the important thing is to try and figure out which of those causes is leading to the irregular periods, not to just cover them up with the pill. And so doing things to ask for there when you go in to see your physician, ask them to check her thyroid, ask them to check the prolactin, ask them to check the male hormones. Those hormones are often elevated in PCOS. Ask them to do an ultrasound to evaluate her ovaries. Women with PCOS have a bunch of tiny little cysts in their ovaries. Basically, press them to give you a diagnosis and not just a prescription. That's what you want them to do. And then once the diagnosis has been made, then you can treat accordingly. If it's high prolactin, you give a medication to bring it down. If it's thyroid disease, there's thyroid replacement. If it's polycystic ovarian syndrome, this is the most important one of all to make sure that you address adequately, because polycystic ovarian syndrome, or PCOS, is associated with increased risks in certain health conditions, including cancer in the uterus, which I have diagnosed as young as 28 years old, diabetes, increased risk for heart disease, and later in life, infertility. These are all serious women's health conditions and general health conditions that a woman could be completely unaware of, that she is at risk for these things simply because her symptoms were covered up with the birth control pill. But knowing that she has PCOS can allow her to be proactive and decrease her risks for these things. Another important thing is that with PCOS, a lot of times, even when they do make the diagnosis, they simply hand out the birth control pill. And they do that because it provides some level of progesterone, which is protective against cancer in the uterus. However, as we discussed earlier, it raises the risk for breast cancer. So you're lowering the risk for one cancer, but you're raising the risk for another. And it's the cancer that she's most likely to get that you are increasing the risk for. So you're not really winning on the risk-benefit analysis there. What you want to do is to consider doing natural progesterone in a fashion that cooperates with a normal menstrual cycle. That will help protect her against uterine cancer. It'll help her have more regular periods. A lot of girls feel more normal that way. But it's not going to increase her risk for breast cancer or for any other cancer for that matter. The other thing that's important is to give them lifestyle changes if they have PCOS. They are more prone to developing diabetes, but if you instill in them values of healthy food choices and healthy exercise regimens, you're going to help them decrease that risk as well. So for her health, it is important. Do not take that prescription for the birth control pill just to give your daughter regular periods. Find out why she's having irregular periods.
It's really interesting because you often hear people who defend the birth control pill saying, well, you know, it helps in some areas of you know,
Medicine.
treating cancer, but it's like pick your poison. I mean,
Right.
why would you even go there?
I know. I mean, it really is terrible. And the shame of it is really that there are so many doctors out there that are just giving the pill out like it's no big deal. And Catholic doctors, too. You know, and like I said, the Catholic doctors I went to were giving out the pill.
My
like it's
people
no big deal.
perish for lack
lack
of
of
knowledge,
knowledge.
Lack of
Hosea
knowledge.
4:6.
Right.
And the
Exactly.
thing is, if a young girl starts taking it for acne, and then she knows that it also has an, you know, a birth control effect, I mean, she'll probably continue taking it into her later years. And when are they going to find out that it's bad? I think we have to share with everyone just what a poison it is
That's
for
right.
our society and for marriages, not only for our health. I mean, this is really Pandora's box.
But I really think that there's all these underlying things going on here. You know, as we said earlier, the doctors and the medical community has been pretty much indoctrinated into this idea that the pill and contraception has to be given, abortion has to be an option, and you have amazing doctors like Dr. Teresa and Dr. Hilders and those have been others who have been trained under him, who are out there just, you know, swimming upstream and are looked at and looked down upon by the medical community. But I think the underlying thing here too is that the medical community has been convinced to promote this culture of over-sexualization and, quite frankly, the culture of death.
That's right. Well, you know, to go back down for a little catechesis, because really, when you think about it, God's way is what's really, He's got our best interest at
God's
heart.
way is the
Yes.
best way.
The best way.
Father knows
And
best.
of course, we know the encyclical Humanae Vitae, Paul VI. I mean,
Most
really,
prophetic encyclical, I think, ever written.
That's right. Let me just read a brief quote from that, and here it is. It's from part of a speech he gave back in 1965, and from which Humanae Vitae came. You must strive to multiply bread so that it suffices for the tables of mankind, and not rather favor an artificial control of birth, which would be irrational, in order to diminish the number of guests at the banquet of life.
Wow, that's beautiful.
It's beautiful.
And then we have a quote from the Catechism. We know that the birth control pill is very detrimental to the health, but the teaching of the Church against contraceptive methods like the birth control pill is in the Catechism, paragraph 2370. Periodic continence, that is, the methods of birth regulation based on self-observation and the use of infertile periods, is in conformity with the objective criteria of morality. These methods respect the bodies of the spouses, encourage tenderness between them, and favor the education of an authentic freedom. In contrast, every action which, whether in anticipation of the conjugal act or in its accomplishment or in the development of its natural consequences, proposes, whether as an end or as a means, to render procreation impossible, is intrinsically evil, like the birth control pill.
That's right.
How many people actually stop, though, and read the Catechism?
No.
Or read, for
Or
example,
read.
Humanae
No.
Vitae, and they just automatically swallow what the culture is giving us. I mean, I've had this conversation with so many people in my own circle, and I know you two have as well.
I know. I mean, it really is a shame. And when I think of, too, the number of people, like good friends in our circle, that their daughters are taking the pill. And you try to warn them not to, and you shouldn't. And you try both ways. Okay, here's the church's teaching, but then look at what the doctors are saying, the good Catholic doctors, that how bad it is, you know. And they just don't want to listen. And I don't know. I think we have to just keep speaking the truth. And I think
Yes.
Dr. Teresa's advice of how to go out there into your own medical community and seek out good medical care, because that's the problem. They're substituting being a good doc by just handing off that prescription.
We only have about 2 minutes left, so we need to get to the homework. Sorry, I didn't mean to cut you off. But Janet, and there's a couple things we want our viewers to do.
That's right. Well, first of all, I just want to remind everyone about our Madonna of the Kitchen, available at the Religious Catalog, and she's our patroness for our series, and of course, very beautiful symbols that are there, and it comes with all the description, and it's good to have around. And if we look to Mary, the true model, then we would be less apt to fall into the trap of the pill. But for homework, of course, one item is to read my book, Recall Abortion, especially I had chapter 10. I did a whole chapter on the pill called A Hard Pill to Swallow, and you can get that at the Religious Catalog. Go to our website, thecatholicviewforwomen.com, where we're going to have, of course, discussion questions. You can sign up for the e-letter, and we will have links to the Humanae Vitae encyclical if you'd like to read that. And in fact, at Priest for Life, Father Pavone has done a beautiful study guide for that encyclical. And That's it for that.
And I think don't be afraid to ask questions of your doctor.
Yeah.
You know, they're not gods.
They're not.
They're men and women, and they are responsible for your health, and you're paying them through your insurance company, and in many cases some pretty high rates to have your best interest in mind, and you really need to be able to be confident. And if they're not answering your questions, then for crying out loud, go find another doctor.
Exactly.
We thank you for tuning in and remembering that the pill is not the answer. The answer is always going to be in the Catholic Church, because Christ is the answer. And that's why we're bringing you these programs on the Catholic View for Women. We'll see you next time. Again, the website, thecatholicviewforwomen.com. Thanks for watching.